Hi there, how's it going? Today, we're going to talk about something that concerns a lot of men, especially as we get older, the prostate. It's a small gland, but its role in a man's body is huge. Tucked in right below the bladder and wrapped around the urethra, it's responsible for producing some of the fluids in semen. In young, healthy men, it weighs about 20 grams. But over time, it's common for the prostate to grow sometimes too much. That's when we start hearing terms like benign prostatic hyperplasia, or simply BPH. Now let's be clear, BPH is not cancer. It's a benign condition, but it can bring a lot of discomfort. As the prostate grows, it presses against the urethra, making it harder to urinate. You might feel like your bladder never fully empties. Maybe the stream is weak. Maybe you're getting up several times a night to go to the bathroom. Sound familiar? These symptoms aren't just annoying, they can seriously affect your sleep, your mood, and your overall health. And naturally, when men start noticing these changes, many wonder, is it prostate cancer? Here's the surprising part. Prostate cancer usually doesn't cause symptoms early on. It grows silently on the outer part of the prostate, far from the urethra, so it rarely interferes with urination at first. BPH, on the other hand, grows from the inside out, so if you're having urinary symptoms, chances are it's BPH, not cancer. Let's be absolutely clear. BPH is one thing. Prostate cancer is something else. One does not turn into the other. Now let's talk about the PSA test, a famous blood test that checks for prostate-specific antigen. Yes, PSA can signal changes in the prostate, but it's not a final diagnosis. A lot of things can cause your PSA to go up: cycling, recent sex, intense workouts, even riding a horse. And both BPH and prostate cancer can raise your PSA levels. That's why seeing a high PSA shouldn't automatically mean panic. Too many men rush into biopsies, and those come with their own risks. A prostate biopsy means piercing the gland in multiple spots, sometimes up to 18. And if the cancer is in an area that wasn't sampled, you might get a clean result. But it doesn't mean it's not there. It's like throwing a net into a lake and saying, "No fish." Just because the net came back empty, it doesn't prove anything. And here's another concern. Some research shows that, in rare cases, biopsies might even help spread cancer cells. But take a breath. Here's some encouraging news. Only about 7% of prostate cancers become aggressive and spread. Most grow very slowly. And chances are, if you have it, you'll die with it, not because of it. That's why in the US and other developed countries, it's common for men over 70 to avoid surgery altogether. Instead, doctors often recommend watchful waiting. Makes sense, right? Autopsies on men over 90 who died of unrelated causes found that more than 50% had prostate cancer they never even knew about. It was there, yes, but it never caused a problem. So ask yourself this. If a cancer takes 20 or 30 years to grow, why rush to cut it out tomorrow morning? Wouldn't it be smarter to slow down, make better choices, and really understand the full picture? Speaking of smart choices, let's talk about diet. There's a powerful natural compound called lycopene found in tomatoes. But don't go reaching for raw tomato juice just yet. Lycopene is fat-soluble. It needs fat to be absorbed properly. So the best way to get it? Cooked tomatoes, like in pizza sauce or warm meals, combined with healthy fats. That's how you maximize its power to support your prostate, both against BPH and possibly even cancer. I hope this helped bring clarity to a topic that often feels overwhelming. Taking care of your prostate is essential, but it should be done with confidence, not fear. And the right information can make all the difference. And speaking of making smart choices, if you're looking for a natural, science-backed way to support your prostate health, we've got something that might just change the game. It's a powerful supplement formulated with ingredients like saw palmetto, lycopene, beta-sitosterol, and other clinically studied compounds designed specifically to support prostate function, reduce urinary symptoms, and promote healthy aging. Thousands of men are already feeling the difference, and you could be next. Click the link in the description to check it out now. Your prostate deserves the best. Your health deserves peace of mind. Take the first step today